Hi, you guys. Welcome back for our daily practice questions. It is day 252, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as the AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and houses all of the resources that I offer. But I also recommend if you're just looking for a one-stop location of my business profile, simply go to Google and search The Nursing Studio. It'll take you here where it houses my contact phone number, my link to website, as well as testimonials from previous review students. All right, y'all. Question number one. A 26-year-old woman presents after spilling hot tea on her arm. Exam shows erythema, blisters, moist skin, and severe pain. Which type of burn does she have? Is it A, first degree burn? Is it B, a second degree burn? Is it C, a third degree burn? Or D, fourth degree burn? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what type of burn does she have? So we need to look at these assessment findings. So we have a 26-year-old woman, because this is asking us a diagnosis question, right? So we have a 26-year-old woman who comes in after spilling hot tea on her arm. The exam shows erythema, blisters, moist skin, and severe pain. This is classic for B, a second degree burn, the blisters, the moist skin, as well as pain. Classic for second degree burn. All right, question number two. A 25-year-old male presents with a superficial partial thickness burn on his forearm. The area is blistered and painful. What is the most appropriate outpatient management? Is it A, topical silver sulfadine or Silvadine, you can think of it as, with sterile non-adherent dressing? B, oral antibiotics for 7 days? C, corticosteroid cream and occlusive dressing? Or D, immediate surgical grafting? Take a moment and tell me what you got, y'all. All right, stem of the question states, what is the most appropriate outpatient management? So again, this is a treatment style question. So you need to look and see if they provided you with a diagnosis. And in this scenario, a diagnosis has not been provided. So you have to run it back and look at the assessment findings, because you got to know what it is to be able to treat it, right? So we have a 25-year-old male comes in with superficial partial thickness burn on the forearm. It's blistered, painful. So you can even think of like the first question scenario. This is a second degree burn. It's blistered, it's painful, it's partial thickness, right? And the way we treat is A, with topical Silvadine and non-adherent dressings. All right. Remembering that with second degree burns being partial thickness, it is going through that epidermis and part of the dermis. And so we want to use those antimicrobials like your Silvadine to help with that. We don't use antibiotics unless there's some type of secondary infection noted. All right, question number three. A 40-year-old male presents with erythematous, painful skin without blistering after working outdoors. What is the best outpatient management? Is it A, topical corticosteroids and antibiotics, B, oral antibiotics, C, supportive care like cool compresses, aloe vera, NSAIDs for pain, or D, Silvadine cream daily? Take a moment and tell me what you got. All right, and stem of the question, what is the best outpatient management? So again, this is a treatment question, so we need to look and see if a diagnosis has been provided, and it has not. So we have to run it back and look at the assessment findings. So we have a 40-year-old male comes in, has an erythematous, painful skin without blistering after working outdoors. Now, here, this is classic as a first degree burn. Think like a sunburn. So somebody's working outdoors, it's red, erythematous, it's painful, no blistering, first degree. Second degree would have had blistering, right? So what are we doing for this? You're just going to do supportive care, right? So C is your best answer. So you want to do like cool compresses. You can do aloe vera because it has like a cooling mechanism as well as a healing mechanism to prevent scarring as well. And then also NSAIDs for pain. All right, y'all. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I offer, feel free to reach out to the nursing studio by giving us a call. You can shoot us a text message or shoot us an email. Um, that's linked on the screen. All of my resources that I offer are linked in the bio of this channel, including my website. And as I mentioned previously, my website is also linked in the description of this video, and it houses all the resources that I offer as well. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.